we'll talk a little bit about a couple different types of classes of drugs, opiates and stimulants, and then we'll talk a little bit about overdose prevention and responding to overdose with Narcan. So first we'll talk about opiates. Opiates are a class of drugs that include this whole list here: opium, heroin, methadone, fentanyl, all of the prescription pills like Percocet and codeine, morphine, Dilaudid, things like that are all opiates, and they are often used in a medical setting, but they're also used recreationally. And there's so many reasons why people might use these drugs, and we're gonna talk about it. So how do opiates make people feel? They can make you feel warm and fuzzy and euphoric, an amazing rush, like getting a big hug. They can make people feel really good. There's many different ways that people might consume these drugs: in pill form, snorting powders, injection, smoking, things like that. There's many different routes of administration, and these are also often prescribed in a medical setting where they're monitored by a medical team, but also used recreationally. So physical effects of opiates: obviously pain relief is a big one. It can also cause constricted pupils, nausea, constipation, and slowed down breathing. And we'll talk about that part a little bit later. But when breathing slows down too much and someone stops breathing from the effects of opiates, that is an overdose situation. There's a lot of fear around opiate use, specifically around fentanyl, and we'll also talk about that later. Many people use these drugs every day and feel good and don't have withdrawal symptoms from their use, but it can cause overdose in higher doses. When folks are using or maybe want to stop their use for opiates, there are medical interventions that exist, treatments to help people with their use. Methadone is a big one. It's the gold standard for opioid use treatment. And what it is synthetic opioid agonist that binds to opioid receptors, and it eliminates withdrawal symptoms and relieves cravings. However, the one unique thing about methadone is that it is highly regulated. So it cannot be prescribed in a doctor's office and must be received through an opioid treatment program or an OTP. There's a lot of stigma around the methadone use, lining up in front of the methadone clinic, having to take your dose in front of a doctor. Methadone clinics often have very short windows of time that they're open. So it might be very hard for someone who needs to get methadone every day to keep a job because they have to go to the methadone clinic every day before they go to work. And that can make it really difficult for people to stay on treatment. And if abstinence is their goal, it can be very hard to remain abstinent because of all the stigma and policy restrictions that exist around methadone. However, that's not the only treatment that exists. Another example of a medical treatment is a buprenorphine, which is a partial opioid agonist, which means that it binds to the same opioid receptors, but it doesn't completely activate them. But in the same way that methadone works, it reduces cravings and withdrawal symptoms, but folks won't get that euphoric effect from the opioid that they would if they were just using the drug on their own. So buprenorphine is different than methadone because it can be prescribed in a doctor's office. In our clinic at Reach, we have a lot of folks on buprenorphine, but it's allowed them to live much more stable lives than they were previously, and also able to get that medication in a discreet and private way as opposed to at a methadone clinic. So these are just two examples of medical interventions that exist for opioid use. What about harm reduction for opiates? This doesn't just include medication-assisted treatment like methadone or buprenorphine, but it also includes things like syringe exchange services, giving people access to safe injection equipment, which reduces the risk of disease transmission and injection-related infections. Not using alone, having someone with you to respond in the event of an overdose. Testing for fentanyl. Fentanyl is a very potent opioid that increases overdose risk. So testing for fentanyl is another harm reduction strategy, but there's so much more to it than just overdose prevention. There's a lot that goes into it. So in harm reduction therapy, what we do at Reach, what folks do in harm reduction interventions is looking at the whole person with fullness and complexity. And this is not just for opiates, but for any substance that someone is using, looking at them as their whole self with all of the elements that they bring to the table and not just their substance use, and shifting the focus away from the substance use itself to the consequences of the use. How is this use affecting your life? How is it going for you? And trying to level that playing field and open up a conversation. There's so many reasons why people use drugs, even when they might have negative consequences. There's many things things that they help people with and many reasons why they use them. So shifting the focus away from not just the substance itself and not demonizing the substance, but just about the whole experience. And also the focus on the person's whole life and their whole being, what they bring to the table. People are not just their substance use. There's so many other things about them to be explored and cared for, which is what we try to do here at Reach. Just another little brief overview on stimulants. So stimulants are another class of drugs that includes things like methamphetamine, cocaine, crack cocaine, Adderall, Ritalin, things like that. And a stimulant increases the activity of the brain chemicals and the dopamine and norepinephrine in the brain. Again, why do people use stimulants? People use them recreationally to feel good. Other practical reasons: increased energy, euphoria, self-medication, increased sexual drive, focus, and attention. And for some folks, they may be prescribed a stimulant that they take every day that they use for treatments of things like ADHD. So people use stimulants for many reasons. There's a large association between stimulant use and sexual activity, which is also why safe sex is such another important harm reduction strategy, especially in the context of drug use. One of the main points I want to bring up about stimulant use is, what is the difference between cocaine and crack? We hear crack cocaine, cocaine. What is the difference? So there's actually not much of a difference, and yet the difference is so huge and so impactful. If you look at it pharmacologically, there's no differences between powdered cocaine and crack cocaine. They're just made a little bit differently. The route of administration is a little bit different. Crack can have a quicker onset and sort of higher peak and then shorter drop than cocaine, but essentially they are the same. What makes the biggest difference is sentencing disparities are largely responsible for the way we understand the differences between these drugs. And that has a lot to do with the war on drugs and the integration of crack into communities of color and how that affected policing in those areas and who was policed. So we think about who was using cocaine, who was using crack, and how was law enforcement responding to those different groups of people. Harm reduction tips for stimulants: you can't really overdose from a stimulant in the same way that you can from an opiate, but what they call it in stimulant use is called overamping. And that can be just from taking too much of the drug, getting really hyped up, paranoia, anxiety, things like that. There's not a lot of medical intervention for stimulant use. There's some research that's been coming out in the past couple of years that discusses medications like Adderall as a treatment for stimulant use, but there's not a ton of research quite yet to back it. But people are looking into that as a medical intervention. However, for someone using stimulants, if they get a little overamped or amped up, anxious, things like that, some practical harm reduction tips: cooling the person down physically with ice packs or fans, drinking water or things like sports drinks, things with electrolytes, trying to get some nutrients into them. Stimulants can often suppress your appetite, so people might not be eating or drinking as much as they would. Putting a cool wet cloth on the forehead or back of the knees, just trying to cool the body down. Putting someone in a quiet room with low light and low stimulation can also help that. Other harm reduction tools: giving out safe smoking kits, clean pipes with clean mouthpieces, having access and using contraception or condoms, using chapstick. So when folks use stimulants, especially if they're smoking, their lips can get very dry and cracked. Using chapstick and keeping that part of you moisturized can also help the spread of diseases like Hep C and HIV. Now we're going to move on to overdose prevention and response with Narcan or naloxone. First, we're going to talk about some key terms. So opioids we just spoke about. Those are pain relievers, prescription painkillers, heroin, and fentanyl. Fentanyl is a highly potent, fast-acting opioid that is used in a medical setting, but when we're talking about it in this context, we're talking about an unregulated drug supply that's in street drugs all over the country, but particularly here. And naloxone or Narcan is a safe medication that can reverse the effects of opioids and prevent a fatal overdose. Narcan is only used for opioids. So for issues involving other types of drugs, Narcan won't work, but specifically for opioids, this is the response to save someone's life. So just before we get into it, when we talk about substance use and we talk about people who use drugs, the words that we use matter. And when we're thinking about these things and having discussions about these things, I challenge you all to think about the language that comes into your mind and the language that you might use to describe some of with these things. And I offer you potentially some other options of ways to describe these things. So using words like addict or junkie, things like that, it's so stigmatizing and it's such a loaded word and phrase. I mean, think about the image that conjures up when you think about the word junkie. And we can just say instead, a person who uses drugs, a person living with a substance use disorder. And that is much more encapsulating of the person with their own humanity as opposed to just a negative word. Even words like clean and dirty. What is the morality of telling someone that they're clean versus not being clean? Are they abstinent? Are they changing their relationship with their substance use? But using words like clean and dirty also carry a lot of stigma. When we talk to people from a harm reduction approach, we acknowledge their right to autonomy and their right to live their lives and do what they want with their body. And using phrases like you should do this or you shouldn't do this is not very helpful. But coming at it from a place of curiosity, would you consider, have you ever tried this? Gives people a way to open up a little bit more and maybe talk about these things a little more comfortably. So just some food for thought. So now we're going to look at some New York City level data. This is all from 2023, the most recent reports that the New York City Department of Health has put out. And you can see here, basically, for the most part, overdose deaths have risen. But if you look really closely at these last two bars right here, the 2022 and 2023 lines, you will see that unintentional drug overdose deaths in 2023 dropped from 2022 to 2023, which is incredible. And that has so much to do with support for harm reduction, support for overdose prevention, opioid settlement funds that have allowed more access to treatments and things like that. However, I will mention with the caveat is that just because the overdose death rates are dropping, it doesn't mean they're dropping in every community. So they're not dropping at the same rate for Black and brown folks as they are for white people. So it's great to see numbers drop, but we need numbers to drop for everyone, which is why bringing naloxone into the community is a really powerful way to enact some change. Here's a map of New York City. It is overdose mortality by neighborhood. And I'll just point out that East Harlem is one of those dark blue spots. It is one of the highest hit areas in New York City by overdose deaths. And I'll also point out, some of you may have seen these maps before. This is a common map that the New York City Department of Health will put out. And you'll often see that rates of other sort of social issues or social struggles are also reflected in these same exact areas. So where we're seeing high rates of overdose, we're also seeing higher rates of poverty, higher rates of hepatitis C, and other sorts of health outcomes. But East Harlem has consistently been one of the hardest hit areas by the drug poisoning overdose death crisis. So most overdose fatalities in New York City in 2023 occurred in a private home. Someone was home by themselves. And that is why it's so important to never use your drugs alone and to have Narcan nearby, because if someone else is there, someone can respond and that person's life can be saved. Fentanyl in the unregulated drug supply. You might hear of things like fentanyl patches or fentanyl lollipops that might be given out for like long-term treatment of pain. This is not what we're talking about here. So this is an unregulated drug supply that is in street drugs. Fentanyl is a potent synthetic opioid that is 50 to 100 times stronger than morphine. Fentanyl is commonly found in drugs sold as heroin. Most of the heroin you will see on the street today is all fentanyl and is not actually heroin. Fentanyl can also be found in crack cocaine, ketamine, methamphetamine, and pills from non-medical sources. And I will just say, this is a bit of my own opinion, but just a PSA, pressed pills that folks are buying off the street can be very dangerous and very contaminated. And I would always suggest buying drugs from a trusted source and testing your drugs with things like fentanyl test strips and always having Narcan around. You don't always know what you're getting, and the drug supply is very wary these days. There's no risk of overdose from touching fentanyl. There's never been a confirmed case. Unfortunately, there's so much fear mongering around substance use. I've seen videos online of police officers in hazmat suits and things like that saying, oh, I overdosed from touching the fentanyl. That's simply not true. People are using these drugs every day, several times a day, and they're not always dying immediately or overdosing immediately. So just a consideration for you all when you're consuming media around overdose or fentanyl, just to think really critically about what's actually being said and who is saying it. How do opioids work? So we already talked a little bit about what they do, but you can see in this little diagram here here, how they attach onto the opioid receptors in the brain. So when someone's overdosing, the process can happen over the course of minutes to hours. I believe it does happen a little bit quicker with fentanyl being so regular in the drug supply. But what basically happens is the quantity or strength of opioids gradually suppresses the involuntary drive to breathe. Breathing gradually slows down, the heart stops, and that is when you have a fatal overdose. What can be done in a situation like this? First, we want to think about what are the common risk factors. A change in someone's tolerance. When people are using the same amount of drugs every day, they build up a tolerance. That's a protective factor. However, if someone goes into treatment or has a significant period of time where they're abstinent for some reason, their risk of overdose is actually going to go way up because their tolerance has dropped. Things like mixing drugs, mixing stimulants and opiates can change the way that someone is feeling. Both of those things can make it harder for someone to know exactly how they're feeling. And also using alone is a huge risk factor, again, because no one is there to respond. So what is naloxone? Naloxone or Narcan. Narcan is the name brand name of the nasal spray. You may have seen these little blue bags around New York City. Naloxone is a safe medication that can reverse the effect of opioids and prevent fatal overdose. There's no risk of dependence. There's no adverse effects. It may put someone into withdrawal after they're given it, which we'll talk about in a moment, but there's no adverse effects, and responders have liability protection in New York State if they respond to an overdose. So how does naloxone work? So once someone gets the naloxone into their body, it can usually take effect within 2 to 8 minutes, lasts in your system for about 30 to 90 minutes. And what's actually happening there is the naloxone is coming in and it's knocking those opioids off the opioid receptors and replacing them with the naloxone, which is what is allowing the person to breathe again. So what's actually happening here is we're restoring their breathing. See that little image right there. So how do we know if someone is overdosing? If you happen upon someone on the subway, in the street, at a doctor's office, at a bar, anywhere where there are people, the person will have slow or stopped breathing, shallowed labor breathing, snoring or gurgling noises. They'll be unconscious or unresponsive. So if you were to say, hey, are you okay? Call their name, they wouldn't respond. They're not just asleep, they are unresponsive. You'll also see discoloration in the lips or fingertips. So for people with a lighter colored complexion, that's like a blue-gray color. For people with a darker complexion, that would be like a gray or ashen color. If you see someone in this situation, it could be an overdose, but it also could be another type of medical emergency. So the first thing you want to do is check for responsiveness, shout to them, say you will call 911. Then you can do what's called a sternal rub, and you can practice this on yourself. If you were just to take your fist like this and to rub your knuckles gently on your breastbone, you'll see that it hurts. We don't want to hurt someone. We're just trying to see if they're awake. They're sleeping. A gentle rub on their chest would cause them to respond. So we don't want to hurt them, but we do want to check for physical responsiveness before we call 911. Someone may be high, but not yet overdosing. If you're in a setting with people where you're using substances and someone looks like what they might call nodding out, if someone responds, they're not overdosing. So what we want to do is know that overdose is still possible and have naloxone nearby, staying with them and trying to keep them alert, talking to them and things like that. When in doubt, we always want to call 911 for medical attention. So we call 911. When we call 911, I want to give this caveat that it's not always safe for people who use drugs to interact with law enforcement or interact with the healthcare system. People might not want to call 911, and that's something that we might need to respect. So when we call 911, you just want to say the person's not breathing, they're unresponsive, say where you are, but keep it very simple. Remember that stigmatizing language that we spoke about and be mindful of that. People may not want this kind of interaction. However, there's also many reasons to call 911. It could be something other than an overdose. We don't know this person's medical history. We don't actually know what's going on with them. There could be other medical complications. Perhaps they fell and hit their head or something like that. Or you might need more naloxone. So when in doubt, call 911, but keep in mind that it is not always safe for folks who use drugs to have those interactions. The 911 Good Samaritan law offers protection to the overdose victim and those who call 911. 911 for possession of a few different things listed here, but it does not provide explicit legal protections for things like open warrants or issues related to immigration or child welfare. So we've checked for responsiveness. We've called 911. Now, how do we give them the naloxone? It's so easy to use. You just take it out of the package. It comes in a blister pack. You put it up the person's nose and hit the plunger, and it goes right up into their nose, into their brain. That's all you have to do. Then you want to time about 2 minutes. If the person doesn't respond in about 2 minutes, you want to give them that second dose of naloxone that will come in your naloxone kit. So all kits contain 2 doses of naloxone. So peel, place, and press, put it up their nose, get it in there, and then 2 minutes later, you want to give that second dose. So since what's happening in an overdose situation is that they're not breathing, breathing is very important. If you know CPR and it's appropriate to do CPR, you can do it when it's appropriate. Do not attempt CPR if you don't know how. But what you can do is rescue breathing. So all naloxone kits do come with a face shield, and getting air into the person's airways is so important. So you just want to pinch the nose closed with one hand and make a seal, and then give 2 even regular sized breaths, and give 1 breath every 5 seconds until help arrives. And this is even more important now as we see new adulterants coming into the drug supply that exacerbate that respiratory depression. When you're not giving Narcan or doing rescue breathing, you want to put the person in the recovery position, which is on their side with their mouth clear in case they were to throw up or anything is in their mouth, to prevent choking. In your overdose rescue kit that the city gives out in this blue bag, you get 2 doses of single-step Narcan, instructions so you don't have to remember everything I'm saying right now, a face shield, a little certificate of completion to write your name on, and gloves. So once you receive your kit, you want to put your name on it that says you've been trained. Your kits will probably also have contact information of where you can get more Narcan, and also instructions. Review those instructions so you are prepared. In summary, naloxone is a safe medication that can reverse the effects of an opioid overdose. We want to look for signs of an overdose: slow or shallow breathing, unresponsive, discoloration in the lips or fingertips. We want to provide support by giving that naloxone, getting medical help, and giving rescue breathing. And if you use your naloxone, you can report it to the city so they can track their data of overdose responses, and you can also get a new kit once it is used. It's so important when we think about overdose response is that if you're choosing to carry Narcan, you're choosing to become a responder. And I think it's important for all of us to just take a moment to reflect on, what does that mean for me as an individual? Some folks may only be comfortable calling 911 and leaving. Some folks may be right in there doing CPR and giving the Narcan. So I think it's really important for all of us to just think about, I'm going to carry this Narcan. What am I comfortable with in this situation, in this type of situation? And also thinking about your own personal safety risks. Are you on a crowded subway at rush hour, or are you alone on an empty street? And what does that mean for you and your level of comfort?
What should you be prepared for when you've given someone Narcan and they wake up? Like, do you need to be prepared for them to be upset or to be sort of jolted? Is there anything that you need to think of in that sense of what the coming back in that moment will look like?
I get comments like this all the time, like, what if the person is aggressive and they're mad and all of these things? And I just ask everyone to take that word aggressive, take that word angry, and just throw it away. This person is coming back from the brink of death, and they are most likely terrified, or at the very least disoriented. So when someone's coming back from an overdose, they may feel scared, they may be confused. That could potentially cause someone to react with an outburst, possibly not. You never necessarily know. My tips are, after giving the Narcan, stand back, give them some space. Imagine how you would feel if you woke up and there was all these strangers in your face standing over you. You'd probably yell too. You'd probably be scared. And also to know that because the Narcan is sort of knocking the opioids off those opioid receptors, the person might be feeling withdrawal symptoms. So there's a chance that they could feel very sick, very nauseous, gastrointestinal issues, sweat sweating, cold sweats, things like that. And if they don't feel good, how that might impact their reaction. So I think the best way to go about it is to be neutral about how you think they might respond, stand back, give them space, gently explain to them, you overdosed. I found you. I gave you Narcan. Do you want to get medical attention? Can I stay with you? And really trying to come at it from a place of empathy. This is a medical emergency. So that's how we have to conceptualize it.
Not taking things personally when people do wake up. It's so jolting for that individual going through this near-death experience. I've often had people get up and be a little bit like confused, not really like violent or agitated, maybe a little agitated, but not really violent, but like confused. And I think that's understandable. So definitely giving them space. I have seen that people will get up and not go to the hospital or not get any attention. You kind of do what you can with sharing that you can go back into overdose and it's good to be monitored and you can have a lot of symptoms, but ultimately it's their choice. So if they decide no, like you can't really control that. So just doing your due diligence. Also, just in thinking about Narcan and using it, it's a very low risk medication in general. Like you do want to be like certain that person's passed out. You want to try to wake them up and stuff. But even if you're like, I'm not 100% sure, it's likely if they're passed out and they're not waking up, it's from opioid overdose. It's really low harm. And it's also one of those medications that's safe to use in children too, if they are using overdose.
Even if they're not overdosing, the Narcan's not going to hurt them. So if you give it to them and it's not an overdose, you still gave it to them when it could have been.
If you give someone Narcan and they wake up and they say that they don't want medical care, there are things that you should make sure they have another dose of Narcan, or if it's not you, then somebody's with them with a dose of Narcan. Are there things that you should do as further harm prevention if they don't want to seek medical care in that moment?
I think one of the biggest things would be staying with the person or having someone who is able to stay with them for at least like 2 or 3 hours. That might not always be possible. It's something you do just have to respect the decision to not seek care. But if it's someone you know or someone is with them, encouraging them to stay together, giving them extra Narcan if you happen to have more, and ensuring that they won't be alone once they're on their way is pretty important if that's possible.
When you were talking about the signs of overdose, mouth foaming, is that a thing that goes with overdose? Would that be indicative of something else?
I don't think it would be directly related from the overdose itself, but perhaps if the overdose caused like a seizure or something, I think we could see that.
I haven't really seen that very often with opioid overdose. It is actually a common thing with seizures. I guess depending on like what they ate or how they're reacting, I guess they could foam at the mouth a little bit.
But that's not in and of itself necessarily indicative of the fact that somebody is overdosing. It could be another medical issue. Think, look out for the other signs in conjunction with it.
But if that person is foaming at the mouth and completely passed out in public,
911.
It may still be from an opioid.
Consider that.
So
I get it.
Because Narcan is really harmless, like I would still give it to that person.
If you encounter someone and you're doing the test and they wake up, but they're very groggy, would that still be a circumstance where you would give Narcan? Or if they wake up, then they're not overdosing? Is that correct?
If the person can respond to you, they're not overdosing. And we don't necessarily want to give someone Narcan if they're not overdosing because we don't want to put them into withdrawal. So if someone is a little groggy or very sedated, but they're still responding to you, what you want to do is stay with them and keep them alert. Keep talking to them. Did they go into the bathroom? Then I'm knocking on the door every 2 minutes. Things like that.
I think sometimes too, and this has been my own perception in the past, is that sometimes you see people nodding. They're standing and they have trouble standing up. If they're still responsive, you're not talking about overdose. That's an effect of the drugs themselves and not an overdose situation.
People do nod or nod out, as they call it, and they're just really high. They probably feel great, actually. They probably are not in distress. If that's someone you happen upon, making sure they don't fall over and keeping them alert, they could slip into an overdose state from that. But if they're responding, if they're breathing, if they're moving, they're not overdosing.
That's a situation you just make sure that person has Narcan. If they are responding, that might not be a situation where they're going to be interacting very much, but that's like what you would be able to do. But don't be giving them Narcan.
They're not overdosing. Absolutely. I think that was one of the things that when I first learned about Narcan is thinking about when is the right moment for that. And you've made it very clear. We're talking about approaching people. Everyone is a person first. Everyone is a person with bodily autonomy. And that we're thinking of harm reduction is absolutely a way that we're working together as a community to care for each other. And I encourage you, if you are somebody who's comfortable doing so, to be someone who carries Narcan with you.
We definitely want everyone to have Narcan and know how to use it too. Obviously, being cognizant of your own safety and in situations. And just because you have Narcan doesn't mean you necessarily need to immediately jump to feeling like you're going to be out on the streets and like saving everyone. I used to be kind of nervous about this too because I'm like a small person where if I'm alone on the subway and with someone, like maybe that's not the situation that I feel comfortable. But when there are other people around, and then also just being able to see people and observe them, if you see someone like laying down on the subway and they're belly breathing, they're fine. So just being more cognizant of what's happening in our community and around us can also give us a sense of belonging and also a sense of actually having a role to help people when they need it. Overdose is such a huge thing, especially in this area. It really is something that affects that individual and everyone else in the community too. We really want us to be able to feel empowered to help as we learn more about harm reduction and being aware of your own safety. When you're in a situation where you do feel safe to administer Narcan, it can feel very rewarding in some ways. Even if that person doesn't necessarily acknowledge it or you don't get that immediate gratification, it's still really nice to be able to do that. You literally are saving people's lives, reminding yourself of that.